What? Why?
Okay. All right. So then what we'll do, you want, I mean,
That's fine.
is that fine? Okay. Then what we'll do here is, I don't know how you want to start it. I will do like, as you asked, I'll just do I'm just going to say, hey, I'm clinic director, and I'm going to say very briefly, as most of you probably know, we have an outpatient vet clinic. We offer a full range of services, including acupuncture, with Dr. Jennifer Wells is going to tell you a little bit more about. And then I don't know if you want to start with us both in frame, or you want me to just twist it. Like, look, I couldn't care less. I truly couldn't care less.
What you could do is, if you wanted to be on your computer,
yeah,
you could do that. That's kind of complicated.
Yeah, I would rather just, have the presentation all from one computer.
Yeah, you can roll away, and I'll roll in.
All right, that's just what I'll do. And then is this the PowerPoint right here?
Yes.
All right, so is it open? Do you mind if I click on it?
No, that's fine. And that's what I wanted to show as an
this white screen.
Yeah, and so what I thought, let's see, is it so once you get out of here, I don't want to launch it yet.
Well,
I wanted to go back.
I've launched it.
Yeah, I want to be back on the settings. There we go. I was gonna share the screen. Is that where you were heading? Yeah,
but let's not do that yet. So what you're gonna do is, once it's time, we're gonna go to share screen, and you're gonna click on that. Click share. And then they're gonna see, then we actually want this in presentation mode. We don't want them to see all that crap on the side.
Right. Yep. That looks good. And it's showing video, audio is on. So yeah, we're good.
Yeah. And so this is actually set up now. So
I'm gonna stop share, and then I can.
Yeah. I'm going to leave this right now. It's just a white screen. So one thing that I didn't check, hopefully we don't have to let people into the meeting.
Yeah, that's whoever set up the meeting would have set that up.
Right. And not me. Right. So we'll just have to keep an eye on it. At least somebody is going to join before it starts. Right. So presumably, so we'll see, like, is it just another participant there or not? So I'm just going to see, I'm going to talk for probably about 20 seconds. I'm going to move out of the way. And then you want to put this on the far side of you, perhaps, so that we don't have this between us as an obstacle to overcome.
Yeah. There. Yeah, I'll let you have your phone so that you're not like.
Yeah, thank you.
Pointing.
Oh, yeah.
I will make sure this.
That wouldn't be distracting, would it? I'm just like.
Like I said, if once we're rolling, if you want to leave, I'm perfectly fine.
I'll play it by ear, but. Again, my take is just, if anything does go wrong, if something, like if the internet acts up, I sometimes find it less stressful to have somebody else who can be also, chip in, but we'll see how we're rolling here.
Okay. I'll just turn this down there. I need to have this around just in case. My daughter is babysitting my husband.
I see, right, of course. Okay.
It's amazing how quick they do those surgeries.
Well, yeah.
His appointment was 9:15, but that's including, getting him down, prepping him. And the doc called me at like 10:45. Yeah, everything looked great. He's in good shape.
Hello, Kay, are you there? Oops. Let's see. Where's the volume control?
Looks like camera and
Looks like she might be muted. Yeah, okay. We have both of those on. So this, if I stop the share, we'll just see us for right now. Okay. Hi, Kay. You're muted. You don't need to unmute, but just to let you know, welcome. We see you there. We're going to get started in just a quick moment. Hello. Oh.
Hi, how's it going?
Good. How are you doing this evening?
Good.
Good. We're going to wait. We're not going to wait long, but we're going to wait just a couple of quick minutes so people can join. But by 7:05, we're gonna go ahead and rock and roll with the presentation.
Sounds good.
All right. I'm going to go mute just because, but we'll be back on in just a quick second. We're just going to wait about 2 more minutes and then we're going to roll. All right. Well, hey, it's about 7:04. I'm going to go ahead and get started because I'm going to do a quick introduction here to get us rolling before I turn this things over to our acupuncture expert. But for those of you that I haven't met, my name is Gary Evans. I'm the clinic director here at the Humane Society of Huron Valley, as probably some or most of you or all of you know. We, on top of taking care of all of the animals that live with us for different periods here in the shelter, we have a full service outpatient vet clinic. We do everything from sick and wellness appointments to surgery to dental appointments. And today we're going to talk about our latest service offering. Dr. Jennifer Wells is going to be talking to us about acupuncture. She is a certified veterinary acupuncturist, and she's going to be talking a little bit about how that works for animals and kind of the benefits that you can expect to see. Dr. Jen has been with us for a long time. She's one of our most talented vets. On top of being an outpatient doctor, she is a surgeon. She does house calls. In fact, she was instrumental in starting that house call program. And there's one more program that she has started called, again, our acupuncture program. So I am going to share the screen and dive into the presentation. It's a small group tonight, so I'll let Dr. Jennifer Wells speak to whether or not she would like you to ask questions as we go or save them to the end. And do forgive us, this is our first time jointly running one of these Zoom meetings together, so hopefully we do it all perfectly, but if not, we'll recover quickly, I promise you. So with that, Dr. Jen, I'm gonna let you go.
Thank you. Great, thank you. And good evening. Thanks for joining us tonight to learn a little bit more about acupuncture. I'm really excited to be bringing this service to Humane Society. And tonight I want to share a presentation with you that will hopefully help you learn a little bit more about acupuncture, the benefits that we see with animals, and sort of what a typical appointment looks like for animals who are undergoing acupuncture. If you have a question while I'm giving the presentation, feel free to go ahead and ask, or you can wait to the end. We will have time at the end to ask questions and address any comments or things that have come up during the presentation. And so to get started, I would like to just give you a definition of acupuncture, a good place to start. And acupuncture is simply the placement of needles through the skin into the body in order to stimulate a healing effect. And to kind of give you a little bit of my background, I studied at the Chi Institute in Florida, and this is one of 3 places in the US where a veterinarian could be trained and certified in veterinary acupuncture. And not only do they teach acupuncture, but they also teach some of the other foundations of what is considered traditional Chinese veterinary medicine. And although we will focus on acupuncture this evening, other areas that fall under that category of TCVM are Chinese herbal medicine, food therapy, and also a practice known as Tui Na, which is sort of a cross between chiropractic and massage. And so we'll focus on acupuncture, even though we do prescribe Chinese herbal medicines here in addition to doing acupuncture. Just to give you a little bit of historical background on acupuncture, it's interesting to look back over history and see how long the acupuncture has been studied and practiced. And so human acupuncture has been practiced in China for over 8,000 years. And from that, the human acupuncture led to veterinary acupuncture, which has been in practice for almost 3,000 years. And this was mostly on agriculturally important animals such as horses, pigs, dogs, chickens. That's where veterinary acupuncture got its start. And mostly they started by using human points, transpositioning those to animals, and then modifying those points based on observation. The couple of pictures that you can see on the screen are a couple of early veterinary acupuncturists. On the left was Zhao Fu, who practiced in the 900 BCs and had many, many students. Bolay is another practitioner who practiced about 300 years later and was the author of a veterinary acupuncture textbook, which is still in use today. So quite a rich history with veterinary acupuncture. This is a modern day version of the veterinary acupuncturist. This is Dr. Shea, who is one of the professors and the founder of the Chi Institute. And he has really continued to push the limits of veterinary acupuncture, insisting that we should do research to find out how and why, not just practice veterinary acupuncture, but to understand it and to continue pushing the limits of what it can do for animals. One of his quotes is, it matters not whether it's ancient or modern, it only matters that it produces a result. And acupuncture certainly does that. I also want to share with you, just kind of looking at how acupuncture is perceived and things that we're able to do to understand it better. This is from the Wall Street Journal, an article that appeared in 2010. I'm not going to read it to you, but just to share that the opening line tells you a little bit about how acupuncture has been viewed. And it says acupuncture has long baffled the medical experts, and I think that's true. That it holds it, there's an invisible life force called Qi traveling up and down the body. And it's used to treat everything from arthritis and asthma to anxiety, acne, and infertility. And it sounds kind of fantastical, but as fanciful as it seems, the article goes on, acupuncture is shown to have real effects on the human body. And now that we have access to things like neuroimaging, Doppler ultrasound, thermal imaging, we can really see how that works. So the acupuncture points that have been used for all these thousands of years, it turns out they correspond to nerve bundles, muscle trigger points, and some arteries and major nerve areas. And so we're understanding more and more, not just that it works, but how that actually works, because it's certainly not intuitive. That putting needles in a body would have an effect to help cure disease or to relieve pain does not make sense to most of us. I want to give you a veterinary example as well. We talk a lot about human acupuncture, but we're all concerned with our four-legged friends. And this is an example from the Journal of the American Veterinary Medical Association. Just a kind of a quick overview of the study that they did. Using 40 dogs that have disc disease and what we would consider kind of a slipped disc in lay terms. And these dogs had various neurologic signs, all of them severe, ranging from having no sensation in the back legs, meaning no mobility, to having intense pain in their back legs. Each of the participants in the study were measured for pain and mobility on a scale, an objective scale, before and after treatment. And the treatments were there were three different treatment groups. One was surgical, one was acupuncture only, and one of the groups combined surgery and acupuncture. I'm going to show you a graph that sort of highlights the findings of that study. And in the surgery group, we can see there's a pain and mobility scale that goes up to 7, with 7 being the most severely affected. The surgery group dropped from 6 down to 5, which is a lot of relief for these patients. The acupuncture group, which started just over 5, 5.2, dropped down to just above 2. So quite a bit of difference, and more mobility, less pain. And then the surgery with acupuncture group did really well, dropping from a 6 on the severity scale down to below 2. which kind of shows how acupuncture alone is great, surgery alone is great. When we integrate the two types of medicine, we can get so much benefit for these patients. I want to just talk a little bit about not just the purpose of acupuncture, but sort of the philosophy behind it and how we view patients and how acupuncture works. The overall purpose of acupuncture is to restore balance and wholeness to the body. This can be used alone, as we talked about, or with conventional medicine or Western medicine. And there are a couple of foundations of traditional veterinary medicine. And these are Yin and Yang, or in popular culture, Yin and Yang. The other foundation is Qi and the movement of Qi. And I'm going to touch on each of those because they're a little bit of a foreign concept for many people. When we talk about Yin and Yang, this represents a balance of opposites in the body. When we have balance, there is health. When there's imbalance, we have disease. Examples in the body are rest and activity. So two opposites that must be in balance. Flexing and extending, the storage of various things and the transport of those things, up versus down, hot versus cold. These are some of the opposites that we look at with acupuncture. And examples of those with when a body wants to rest and it's unable to, and we get activity when the body is trying to rest, we can have things like seizures or tremors. Another example would be like with up and down. Food, when it is taken in and swallowed, it should continue downward and the journey should continue down. But with an example like vomiting, the food is going upward. It's an imbalance, and so it's an unhealthy body. The other foundational piece is Qi, and Qi is a little harder to wrap your mind around, but it's considered the vital energy that's flowing through the body, takes on many forms, many purposes in the body, and if there's a shortage of that vital energy or a blockage of that, then we have disease or pain. And another way to kind of think about Qi is like this, that blood, we can easily follow the concept of blood flowing through arteries and veins, which would have been a foreign concept 8,000 years ago, but we understand it very well now. Same with electricity flowing through the body, flowing through neurons and nerves, and allowing us to sense and move. Qi is just another force that moves in the body through meridians and along points in the body, acupuncture points. And touching on that, on the meridians and points, which is sort of the keystone piece of acupuncture, we can kind of think of meridians like being highways on the body. And these highways ideally have a smooth traffic flow. So if we think of a map, and we know there's a start and there's a finish to these highways. We know exactly where they move and how traffic should move along those. That is like meridians on the body. The acupuncture points are more like cities. They are known stops along the way with a longitude and a latitude. They're in very, very specific locations. And those are the areas we access with acupuncture needles. And this is a bit of an exaggeration, but I think it makes a point that this animal encountered a porcupine and has many, many needles in the body, but probably none of those are in an acupuncture point that is going to help him. So they have to be very specific. And just a few needles in the right place, it can make a big difference in comfort and disease control. This is a kind of a roadmap of a dog's body. This is just showing a few of the meridians that we use. So the lines represent those highways, those meridians that Qi or energy flow along. And each of the circles represents an acupuncture point, or sort of the cities along the way. There are nearly 400 points on animals. We use about 150 of those very commonly. And each of those points targets a specific organ and a function. And so with very few points, we can achieve a difference and for the health of the animal. So I wanted to talk a little bit about how we use acupuncture, how we make animals feel better and address their disease. In 2003, the World Health Organization listed 28 symptoms and diseases that the research had shown scientific proof confirming that acupuncture is beneficial. And I want to tell you a little bit about the different disease processes that we treat commonly with acupuncture. Probably the number one thing that we treat is pain. And so pain is common. We have many medications that can help treat pain, but acupuncture along with medication or by itself can be really powerful in helping animals have a good quality of life. Nerve malfunction or injury is another common use for acupuncture. Any type of GI issue such as vomiting, diarrhea, constipation, any of those can benefit from acupuncture, and also Chinese herbal medication. Seizures, sometimes we can reduce the medication amounts that we're using to help animals who are seizuring. Animals who are paralyzed or have paresis or partial paralysis can benefit from acupuncture, much like the study that I was telling you about, that when animals are not very mobile, we can really help them a lot with acupuncture. Coughing from a variety of causes, whether it's infectious or heart-related, can benefit from acupuncture. Liver and kidney disease, both very common findings in companion animals, can benefit. And in fact, in conventional medicine, we have no way of reversing kidney disease to any extent. We just manage symptoms and try to slow down the disease progression. With acupuncture, we can actually roll back the clock a little bit with kidney disease and have them improve with their kidney values. So that's a really exciting part of acupuncture. Urinary incontinence. Right now, most animals are controlled with medication. We can either replace or reduce medication with the use of acupuncture. Cancer patients benefit for many reasons with acupuncture. It can help with nausea associated with chemotherapy. It can keep their appetite good. It can help them with pain related to cancer. So many benefits there. Itching, such as seasonal allergy itching, can also be reduced quite a bit with acupuncture. And there are myriad of eye and ear conditions that can be helped as well. And heart disease, especially animals that do not tolerate the medications well or have some type of comorbidity where they maybe can't take one of the medications that we would prescribe, can benefit from acupuncture as well. The way that treatment with acupuncture works, we evaluate the animal, make some decisions about how to treat, and then we know that acupuncture is cumulative. And so, one treatment with acupuncture, while it can be beneficial by itself, is not going to reverse disease or keep an animal pain-free. So what we generally do is an initial consultation. We assess the condition of the animal. We get a history, what is currently being done for the animal with conventional medication. And we also look somewhat at personality or constitution type, which is a little bit different than conventional medicine. We find that certain personality types respond better or worse to acupuncture. So we take that into consideration too. And then we do a traditional Chinese veterinary medical exam, which looks a little bit different than what you're accustomed to seeing done with conventional medicine. And we make a diagnosis, a pattern diagnosis. So it's very different than what you would have as a diagnosis with Western medicine. Rather than saying an animal has arthritis, they may have something like kidney yin deficiency with localized stagnation of qi. And so it sounds different, it is different. But with just a pattern diagnosis, we're able to then treat. So whether we have lab work or x-rays, those things are beneficial, but it does not keep us from treating the animal if we don't have those things. Follow-up is very individualized based on the patient's response to acupuncture and also based on the condition that they have. So the frequency with which we do that depends a lot on their condition. It would be pretty typical to do 3 to 4 treatments in the first month with most conditions, and then perhaps settling to 1 to 2 treatments per month. And then some conditions we can go very infrequently. For instance, seasonal allergies, sometimes every 3 to 6 months for maintenance, or ear issues. And so it really does depend on the patient and what they're presenting with. One question I get asked a lot is, will my animal actually tolerate acupuncture? Will they sit still while someone puts little needles in them? And so far, I've not met a patient that won't allow some acupuncture. Some of them will tell us that you're pushing it too far, or I don't like needles in my leg, only on my back. But in general, animals tolerate it really well. And part of the reason is the needles are very, very tiny. So they're hair thin, which is very helpful. And we also combine that. We can use fewer needles and use things like Electro Acupuncture, where we're using electrodes on the needles that we've placed in order to generate a mild current to help with the acupuncture, have it last longer and have a more profound effect. And most animals find it very soothing. Many times they fall asleep while they're having Electro Acupuncture done. And afterwards they feel really good, almost like they'd had a deep muscle massage, and they're very sleepy and very content. We also use Aquapuncture, and we can use fewer needles again by using Aquapuncture. And this is where we inject fluid into the point, and that can be either vitamin B12 or sterile saline, and it just helps the points be stimulated longer so that we get a medical effect. We also use something called Moxibustion, where we are using an herbal stick to warm the acupuncture point or the needle that's in an acupuncture point. And that can be very beneficial for some patients. And finally, we can also use laser stimulation. So we place the needle and then use cold laser therapy in order to drive the effect longer and stronger. And so to kind of wrap up what I have to present to you tonight, I want to show you some of the acupuncture patients that we have treated at Humane Society. I just have a few to share, some of our fan favorites here who have benefited from acupuncture. This is Wendy, and she is one of those cats that lets us know exactly what we're allowed to do and what we're not allowed to do. She is a cancer patient who has been receiving acupuncture for about 8 months, and is helping with appetite and energy and nausea associated with the chemotherapy that she's receiving. And our goal with her was to get her doing zoomies again around the house. And she has started doing that over the last couple of months. And so she feels good, and she's tolerating her treatments well. This is Spike, who has been treated for about 10 months now for arthritis and other lameness issues, as well as seizures and diarrhea. So he has quite a few small problems, and has tolerated treatment well, has done very well for us. And this is Caesar, who had received treatments for quite a while for a degenerative neuromuscular disorder. And our goal with him was to get him to his 13th birthday, which he got to his 13th birthday and then went many months beyond, and just kept him comfortable and mobile. that was our goal with him. And then this is Wesley, who was a very special dog to everyone here at the Humane Society. He came in with an injury. You can see that he looks, quite sad, and he received quite a few acupuncture treatments. And I think this picture really shows how tolerant animals are. He's a 4-month-old puppy in these pictures, and he's falling asleep while he's getting electro acupuncture. He's very, very comfortable. And I want to finish off, I want to show you a very short video that was put together last week for our Walk and Wag event. And it tells Wesley's story better than I can tell it. And so this is about a two-minute video that I'd like to finish up with. And that is Wesley's story. It gets to me every time. And so to conclude this part of the presentation, I just want to tell you acupuncture is exciting. We're all very excited about offering this here. It's a very well tolerated method to reach a state of balance, to reach a state of health. And it's evidence-based medicine. It doesn't replace what we do in the outpatient clinic as far as conventional medicine, but it complements it very well. And I'm happy to take any questions that you may have at this time. I'll turn off the presentation. Any questions that occur to you?
Actually, Dr. Jai, I do have a question. Sure. I mean, I know you've been out to my house to do the visit with my cats, but would something like megacolon be able to be something that would be that acupuncture could help with, or no?
Mm-hmm. Yeah, there's a protocol for that, and we see that with or without medicine, we see benefit to that. It usually takes some time. We see it taking a month or more to really reverse some of the issues that you see with megacolon. But I'd be happy to see one of your kitties and try that out.
Yeah, and then just I mean, I know that I know how difficult it is, how backed up you guys are for, you know, regular visits. Is something like this also that backlogged?
Actually, we are open to acupuncture. We have some time set aside for just acupuncture. So
Okay.
I think a little easier to get in for that.
Okay. Okay.
And we also do it at home too. So we
Okay.
house call acupuncture too.
Okay. Good to know.
So if no one else has questions, I think we'll end here. We appreciate you stopping by and learning a bit about acupuncture. If questions occur to you later, if you want to give us a call, be happy to talk with you more about that. Have a good evening, and thank you.
Thank you.
Bye.